the Public Med Central, National Library of Medicine, National Center of Biotechnology Information. As a library, NLM provides access to scientific literature. Inclusion in an NLM database does not imply endorse or agreement with contents by NLM or the National Institute of Health. Exploring the therapeutic effects of yoga and its ability to increase quality of life by Catherine Woodyard. Abstract. The objective of this study is to assess the findings of selected articles regarding the therapeutic effects of yoga and to provide a comprehensive review of the benefits of regular yoga practice. As participation rates in mind-body fitness programs such as yoga continue to increase, it is important for healthcare professionals to be informed about the nature of yoga and the evidence of its many therapeutic effects. Thus, this manuscript provides information regarding the therapeutic effects of yoga as it has been studied in various populations concerning a multitude of different ailments and conditions. Therapeutic yoga is defined as the application of yoga postures and practice to the treatment of health conditions and involves instruction in yoga practices and teachings to prevent, reduce, or alleviate structural, physiological, emotional, and spiritual pain, suffering, or limitations. Results from this study show that yogic practices enhance muscular strength and body flexibility, promote and improve respiratory and cardiovascular function, promote recovery from a treatment of addiction, reduce stress, anxiety, depression, and chronic pain, improve sleep patterns, and enhance overall well-being and quality of life. Keywords: alternative therapy, depression, pain, quality of life, therapeutic yoga. Introduction. A 3,000-year-old tradition, yoga is now regarded in the Western world as a holistic approach to health, and it's classified by the National Institute of Health as a form of complementary and alternative medicine, CAM. The word yoga comes from the Sanskrit root yuj, which means union or yoke, to join, and to direct and concentrate one's attention. Regular yoga practice of yoga promotes strength, endurance, flexibility, and facilitates characteristics of friendliness, compassion, and greater self-control, while cultivating a sense of calmness and well-being. Sustained practice also leads to important outcomes such as changes in life perspective, self-awareness, and an improved sense of energy to live life fully and with genuine enjoyment. The practice of yoga produces a physiological state opposite to that of fight or flight stress response, and with that interruption in the stress response, a sense of balance and union between the mind and body can be achieved. Yoga is a form of mind-body fitness that involves a combination of muscular activity and internally directed mindful focus on awareness of the self, the breath, and energy. 4 basic principles underlie the teachings and practices of yoga's healing system. The first principle is the human body is a holistic entity comprised of various interrelated dimensions inseparable from one another, and the health or illness of any one dimension affects the other dimensions. The second principle is individuals and their needs are unique and therefore must be approached in a way that acknowledges that this individuality and their practice must be tailored accordingly. The third principle is yoga is self-empowering. The student is his or her own healer. Yoga engages the student in the healing process by playing an active role in their journey towards health. The healing comes from within instead of from outside source. A greater sense of autonomy is achieved. The fourth principle is that the quality and state of individual's mind is crucial to healing. When the individual has a positive mind state, healing happens more quickly, whereas if the mind state is negative, healing may be prolonged. Yoga philosophy and practice were first described by Patanjali in the classic text Yoga Sutras, which is widely acknowledged as the authoritative text on yoga. Today, many people identify yoga only with asana, the physical practice of yoga, but asana is just one of the many tools used for the healing in an individual. Only 3 of the 196 sutras mentioned asana, and the remainder of the text discusses the other components of yoga, including conscious breathing, meditation, lifestyle and diet changes, visualization, and the use of sound, among many others. In Yoga Sutras, Patanjali outlines an 8-fold path to awareness and enlightenment called Ashtanga, which literally means 8 limbs. The 8 limbs are comprised of ethical principles for living meaningful and purposeful life, serving as a prescription for moral and ethical conduct and self-discipline. They direct attention towards one's health while acknowledging the spiritual aspects by one's nature. Any of the 8 limbs can be used separately, but within yoga philosophy, the physical postures and breathing exercises prepare the mind and body for meditation and spiritual development. Based on Patanjali's 8 limbs, many different yogic disciplines have been developed. Each has its own technique for preventing and treating disease. In the Western world, the most common aspects of yoga practice are the physical postures and breathing practices of Hatha yoga and meditation. Hatha yoga enhances the capacity of the physical body through the use of series of body postures, movements, asanas, and breathing techniques. Pranayama. The breathing techniques of Hatha yoga focuses on conscious prolongation of inhalation, breath retention, and exhalation. It is through the unification of the physical body, breath, and concentration while performing the postures, or asanas, and movements that blockages in the energy channels of the body are cleared and the body energy system becomes more balanced. Although numerous styles of Hatha yoga exist, the majority of studies included in this manuscript utilizes the Iyengar style of yoga. The Iyengar method of Hatha yoga is based on the teachings of yoga master B.K.S. Iyengar. Iyengar yoga places an emphasis on standing poses to develop strength, stability, stamina, concentration, and body alignment. Props are utilized to facilitate learning and to adjust poses, and instruction is given on how to use yoga to ease various ailments and stressors. Yoga is recognized as a form of mind-body medicine that integrates an individual's physical, mental, and spiritual components to improve aspects of health, particularly stress-related illnesses. Evidence shows that stress contributes to the etiology of heart disease, cancer, and stroke, as well as other chronic conditions and diseases. Due to the fact that stress is implicated in numerous diseases, it is a priority to include a focus on stress management and reduction of negative emotional states in order to reduce the burden of disease. Viewed as a holistic stress management technique, yoga is a form of CAM that produces a physiological sequence of events in the body, reducing the stress response. The scientific study of yoga has increased substantially in the recent years, and many clinical trials have been designed to assess its therapeutic effects and benefits. As participation rates in mind-body fitness programs such as yoga continue to increase, it is important for healthcare professionals to be informed about the nature of yoga and evidence of its many therapeutic effects. Thus, in review of the literature is timely and important and provides information regarding the therapeutic effects of yoga in various populations concerning a multitude of different ailments and conditions. Therapeutic yoga is defined as the application of yoga postures and practice to the treatment of health conditions. Yoga therapy involves instruction in yoga practices and teachings to prevent, reduce, or alleviate structural, physiological, emotional, and spiritual pain, suffering, or limitations. Yoga practices enhance muscular strength and body flexibility, promote and improve respiratory and cardiovascular function, promote recovery from and the treatment of addiction, reduce stress, anxiety, chronic pain, and improve sleep patterns, and enhance overall well-being and quality of life. Methods. In order to locate research, studies, and interventions that examine the therapeutic effects of yoga, databases were searched through Yoga Scholar via a university's web browser. Initially, the following keywords were entered into the database via the advanced search option: yoga and therapeutic effects. This search was conducted to obtain general information regarding yoga's therapeutic effects in the existing literature. Substantially, a second search was conducted using the following keywords or exact phrases: hatha yoga, therapeutic effects of yoga, stress, anxiety, depression, pain, and chronic disease. The following criteria were used for including studies in this review. 1. The article had to be peer-reviewed. 2. Published between the years of 1990 and 2009. 3. The intervention had to incorporate some form of yoga or meditation. And 4. Effects of yoga on some outcome were measured. In order to select the articles included in the manuscript, several steps were taken. First, the title was read. If the article appeared appropriate to the examination of the therapeutic effects of yoga, it was saved to a folder. The articles describing interventions that utilized yoga as means to achieve some health outcome were chosen for further review. Each of the articles chosen were then thoroughly read and reviewed. The articles chosen include a broad spectrum of the benefits, application, and therapeutic effects of yoga. Results. Mental health problems such as depression, anxiety, stress, and insomnia are among the most common reasons for individuals to seek treatment with complementary therapies such as yoga. Yoga encourages one to relax, slow down the breath, and focus on the present, shifting the balance from the sympathetic nervous system and the fight or flight response to the parasympathetic system and to the relaxation response. The latter is calming and restorative. It lowers breathing and heart rate, decreases blood pressure, lowers cortisol levels, and increases blood flow to the intestines and vital organs. One of the main goals of yoga is to achieve tranquility tranquility of the mind and create a sense of well-being, feelings of relaxation, improved self-confidence, improved efficiency, increased attentiveness, lowered in irritability, and an optimistic outlook on life. The practice of yoga generates balanced energy, which is vital to the function of the immune system. Yoga leads to an inhibition of the posterior or sympathetic area of the hypothalamus. The inhibition optimizes the body's sympathetic responses to stress stimuli and restores autonomic regularly reflex mechanisms associated with stress. Yoga practices inhibit the areas of responsible of fear, aggressiveness, and rage, and stimulate the rewarding pleasure centers in the median forebrain and other areas, leading to a state of bliss and pleasure. This inhibition results in lower anxiety, heart rate, respiratory rate, blood pressure, and cardiac output in students practicing yoga and meditation. Consistent yoga practice improves depression and can lead to significant increases in serotonin levels, coupled with decreases in the levels of monoamine oxidase, an enzyme that breaks down neurotransmitters, and cortisol. A range of therapeutic approaches is available for the management of depressive episodes, but many patients turn to complementary therapies due to the adverse effects of medication, lack of response, or simply preference for the complementary approach. A number of studies demonstrate the potential beneficial effects of yoga interventions on depression, stress, and anxiety. Improved flexibility is one of the most obvious benefits of yoga. With continued practice comes a gradual loosening of muscles and connective tissues surrounding the bones and joints. This is thought to be one of the reasons that yoga is associated with reduced aches and pains. Yoga helps to build muscle mass and maintain muscle strength, which protects from conditions such as arthritis, osteoporosis, and back pain. During a yoga session, the joints are taken through their full range of motion, squeezing and soaking areas of cartilage not often used and bringing fresh nutrients, oxygen, and blood to the area, which helps to prevent conditions like arthritis and chronic pain. Without proper sustenance, neglected areas of cartilage will eventually wear out and expose the underlying bone. Numerous studies have shown that asana, meditation, or the combination of the two reduce pain in people with arthritis, carpal tunnel syndrome, back pain, and other chronic conditions. Yoga also increases proprioception and improves balance. Yoga increases blood flow and levels of hemoglobin and red blood cells, which allows for more oxygen to reach the body cells, enhancing their function. Yoga also thins the blood, which can decrease the risk of heart attack and stroke, which are often caused by blood clots. Twisting poses wiring out venous blood from internal organs and allow oxygenated blood to flow in when the twist is released. Inverted poses encourage venous blood flow from the legs and pelvis back to the heart and then pump through the lungs where it becomes freshly oxygenated. Many studies show yoga lowers the resting heart rate, increases endurance, and can improve the maximum uptake and utilization of oxygen during exercise. Consistently getting the heart rate into aerobic range lowers the risk of heart attacks. While not all yoga is aerobic, even yoga exercises that do not increase heart rate into the aerobic range can improve cardiovascular functioning. While yoga is not a cure for cancer nor a definite way to preventing it, yoga increases physical, emotional, and spiritual wellness and brings about a certain peace of which many cancer patients desire. Yoga, breathing exercises, and meditation can reduce stress, promote healing, and enhance quality of life for patients with cancer. The growth of tumors and other cancer indicators are exacerbated by stress. Thus, it is especially important for people with cancer to reduce and manage stress effectively. Several premises exist as rationale for applying yoga-based interventions with cancer patients. Research suggests that yoga can produce an invigorating effect on mental and physical energy that improves and reduces fatigue. Additionally, when practicing yoga, a fundamental emphasis is placed on accepting one's moment-to-moment experiences and creating mindfulness and not forcing the body past its comfortable limits. Having a healthy sense of acceptance is especially important for individuals dealing with life-threatening illnesses, as it decreases the stress of one's experiences from unpleasant symptomology. Initially, cancer patients likely benefit from the poses themselves, which are designed to exercise each and every muscle, nerve, and gland throughout the body. The postures precisely address the tension, holding, and the blockage of energy in any particular joint or organ. As this tension is released, energy flows more readily throughout the body and allows patients to experience a sense of increased well-being and a strength as balance of the mind, body, spirit. While stimulation is good, too much taxes the nervous system, and yoga provides relief from excess stimulation and the stressors and hectic nature of modern life. Restorative postures, savasana, pranayama, and meditation encourage pratyahara, a turning inward of the senses, which enables downtime for the nervous system, the byproduct of often being improved sleep. Pharmacological treatment of insomnia is often associated with hazardous effects such as states of confusion, psychomotor performances defects, nocturnal falls, dysphoric mood, impaired intellectual functioning, and daytime sleepiness, especially in older adults. Therefore, alternative forms of therapy for improving sleep are becoming utilized more frequently. These alternative therapeutic approaches can be generally classified into three categories: behavioral-based educational methods, E.G, avoiding caffeine or other stimulants before bedtime; relaxation techniques, E.G, progressive muscular relaxation, yoga and meditation; and formal psychotherapy. Because of its ability to increase relaxation and induce a balanced mental state, yoga has been studied to evaluate its possible effects on sleep and insomnia. In summary, stress has a negative impact on the immune system, and prolonged exposure increases susceptibility to disease and leads to physical and mental health problems such as anxiety and depression. Practicing yoga and meditation as a means to manage and relieve both acute and chronic stress helps individuals overcome other comorbidities associated with diseases and leads to increased quality of life. As a non-pharmaceutical form of treatment, yoga-based interventions are an alternative option for the treatment of mood disorders. Further investigation of yoga as a therapeutic intervention in depressive disorders is needed, and future studies should seek to identify which of the yoga-based interventions is most effective and what levels of severity of depression are more likely to respond to this approach. In addition to the effects of yoga on mood disorders and stress reduction, yogic practices are shown to improve cardiorespiratory performance, psychological profile, and plasma melatonin levels, and also significantly reduce systolic blood pressure, diastolic blood pressure, and mean arterial pressure, and orthostatic tolerance. Furthermore, yoga helps to improve the cardiovascular efficiency and homeostatic control of the body and results in improvements in autonomic balance, respiratory performance, and overall well-being. Yoga-based lifestyle modifications were also shown to aid in regression of coronary lesions, as well as to improve myocardial perfusion in patients with CAD. Inevitably, cardiovascular parameters alter as one ages, but these age-related deteriorations in cardiovascular functions are slower in persons who practice yoga regularly, as yoga practitioners had lower heart rate as well as lower systolic and diastolic blood pressure than matched controls. Numerous studies show that asana, meditation, or a combination of the two can reduce pain and disability while improving flexibility and functional mobility in people with a number of conditions causing chronic pain. Additionally, in some cases, use of pain medication was reduced or eliminated completely. Yoga was also shown to improve gait function and reduce age-related changes in gait among a group of healthy, non-obese elders. Regarding yoga's effects for cancer patients, results show a decrease in post-chemotherapy-induced nausea frequency, nausea intensity of anticipatory nausea, and anticipatory vomiting. Additionally, yoga subjects reported decreased anxiety, depression, and distressful symptoms, and also showed significantly reduced toxicity scores compared to the controls. Results from another study show patients experienced significant lower levels of pain and fatigue, and higher levels of invigoration, acceptance, and relaxation following participation in yoga intervention. Yoga, breathing exercises, and meditation can reduce stress, promote health, increase energy, decrease adverse treatment effects, and enhance quality of life for patients with cancer. Yoga's ability to increase relaxation and induce a balanced mental state was studied to evaluate its effects on sleep quality and improving insomnia. Regular practice of yoga resulted in a significant decrease in the time taken to fall asleep, an increase in the total numbers of hours slept, and in the feeling of being rested in the morning. Additional yoga had a positive influence on sleep patterns in the individual's lipoma. Furthermore, participation in yoga classes improved self-reported quality of life as well as measures of physical function among elderly population. According to the Buddhist philosophy, the roots of addiction are in the mind and the practice of mindful meditation encourages addicts to accept the basic impermanence of human experience and help them to develop a detached awareness of thoughts. Yoga and meditation practices exert positive influence on addictive behaviors. Through the practice of yoga, addicts shift from self-inflicted harm and disrespect towards their bodies to more respectful, caring, and loving behaviors. Eating disorders are a specific type of addiction, and yoga appears to be beneficial in improving body image disturbances and useful in the recovery from eating disorders. One study found that female yoga practitioners attribute their positive feelings and sense of well-being to yoga practice and report less self-objectification, greater satisfaction with physical appearance, and a fewer disordered eating attitudes compared to non-yoga practitioners. The finding of the aforementioned studies examining the psychological and physical outcomes of yoga proved difficult to summarize and draw concrete conclusions due to variation in the research designs, differences in the duration and frequency of yoga classes, and differences in the specific yoga programs and populations being studied. Nonetheless, results from the included studies demonstrate many of the numerous therapeutic effects, benefits, and profound healing power of yoga. Discussion. Rapidly emerging in the Western world as a discipline for integrating the mind and body into union and harmony when adopted as a way of life, yoga improves physical, mental, intellectual, and spiritual health. Yoga offers an effective method of managing, reducing stress, anxiety, and depression, and numerous studies demonstrate the efficiency of yoga on mood-related disorders. Currently, treatment of anxiety and depression involves more psychological and pharmaceutical interventions. However, mind-body interventions are becoming increasingly popular as means to reduce stress in individuals. Yoga, a form of mind-body exercise, has become an increasingly widespread therapy used to maintain wellness and alleviate a range of health problems and ailments. Yoga should be considered as a complementary therapy and alternative method for medical therapy in the treatment of stress, anxiety, depression, and other mood disorders, as it has been shown to create a greater sense of well-being, increase feelings of relaxation, improve self-confidence and body image, improve efficiency, better interpersonal relationships, increase attentiveness, lower irritability, and encourage optimistic outlook on life. Researchers are only beginning to understand how disciplines such as yoga promote personal growth and health and well-being. By acknowledging the unity of mind, body, and spirit, mind-body fitness programs, i.e., yoga, can assist people in the pursuit of peace, calmness, and greater wholeness and integration in their lives. Healthcare professionals, health educators, and the like need to be aware of the potential of yoga as an important component of personal wellness plan. While no concrete guidelines exist regarding the frequency of practice, the more you practice, the more you benefit. Yoga is a personal practice, and as such, frequency and duration of personal questions and with individual answers. Practice should happen with wisdom and should be modified to meet individual needs and goals. Individuals should practice as often as possible, especially in the beginning. The length of the induction phase will vary depending on an individual's initial level of fitness and health status. The more difficult yoga is for someone in the beginning, the more the body needs it. While modern medicine has the ability, in many cases, to heal physical diseases and alleviate psychological disorders, it is argued that purely medical approach is far less effective in the healing and emotional, intellectual, and personality layers of the human entity. The discipline of yoga offers individuals a timeless and holistic model of health and healing, and although it may not result in complete elimination of physical diseases and or adverse conditions from the body, it offers a holistic path of healing. There exists an indisputable connection between a person's overall physical and mental health and the inner peace and well-being yoga is designed to achieve. Yoga suspends the fluctuations of the mind and by acting consciously, we live better and suffer less. Aho, aloha, namaste.